data, because he was reversing terminal diseases with rice and fruit, diseases understood to be incurable by the best of modern medicine at the time. Intensive investigations into his clinic vindicated his work, which other researchers were then able to replicate. Kempner was criticized for his lack of controls, meaning that when patients came to him, he didn't randomly allocate half to his rice treatment and put the other half on conventional therapy to see which group did better. Kempner argued that the patients each acted as their own controls. For example, here's a patient before the rice diet. The medical profession threw everything they had at him, and his blood pressures were still as high as 220 over 160, whereas normal is considered more like around 120 over 80, which is where the rice diet took him. Had he not been given the rice diet, it's true his pressures might have been even lower, 0 over 0, because he'd likely be dead. The quote-unquote control group in Kempner's day had a survival expectancy estimated at 6 months. To randomize patients to conventional care would be to randomize them to their deaths. One can compare those who stuck to the diet, though, to those who didn't. Here's a chart showing the survival of 70 of the kind of sickest of the sick that showed up at their clinic. Of those that started the rice diet but then stopped it within a year, 5 lived, and 19 ended up dead. For those who made it a year but then gave up on the diet, instead of an 80% chance of dying, they had more like a 50-50, flip of the coin. But of those that stuck with the program, 90% lived to tell the tale. Beginning in the 1950s, drugs became available that effectively reduced blood pressure in hypertension, leading to a decreased demand for the rice diet. What conclusions can we draw from this all-but-forgotten therapy for hypertension? Not only was it the first effective therapy for high blood pressure, it may be equal to or more effective than our current multi-drug treatments. This causes one to speculate on the current practice of placing patients on one drug, then another, perhaps a third, until the blood pressure is controlled, with lip service advocacy of moderate reduction in dietary sodium, fat, and protein intake, while the impressive effectiveness of the rice-fruit diet, which is able to quickly stop the leakage from our arteries, and lower increased intracranial pressure, reduce heart size, reverse the EKG changes, reverse heart failure, reduce weight, and markedly improve diabetes, is ignored. So, should we return to the Kempner protocol of starting with the most effective therapy, saving drugs for patients who fail to respond, or who are unable or unwilling to restrict their diet? Look, today many people follow a vegetarian diet as a choice, which is similar